So I'm going to share that. You can just tell me when to proceed.
Sounds good. Well, my name's Cherie, and this is Ashley, and we are the diabetic educators here in the clinic. So today, something I deal with a lot is the cost of insulin. We hit the donut holes and a lot of high deductibles, things like that. So I just thought I'd put all these resources into one. So if you want to go to the next screen. So the first thing is savings cards. So these can be a little bit tricky. A lot of people try to use them when they're Medicare. So this doesn't work for Medicare or Medicaid patients or TRICARE sometimes because they are government assisted. So the Sanofi one up here, this one is actually what I consider special. It can actually be used even if the medication isn't covered under their saving or their plan at all, or needs a prior authorization. They can actually put this through and it will still give them the medication. The cost may have changed a little bit, but it'll still give them the medication at a decreased cost. Whereas the other ones down here, Tresiba, Basaglar, U500, and then the Novolog and Humalog, these savings cards often have to have some coverage for the insurance to cover them a little bit, and then this one just helps with their copay. So on the next screen, we have vouchers. So here at WVU, we don't accept samples. So these come in handy for us, but it's also a lot easier than actually having to store the medication. So our reps, and you can probably reach out to your representatives, we have them for Toujeo, U500, and then what I call the golden ticket over here. So this one will actually cover one box or one vial of any Lilly product. And these can just be given to the patient or called into the pharmacy, so the patient doesn't even have to come to your office to get the medication if you have someone who lives far away. The U500 one in the middle, it actually covers up to 7 boxes or 14 pens free. So we usually write the prescription for 7 boxes, no refills, so the patient can utilize the whole voucher. And then the Toujeo is just for 1 free box of Toujeo. So if you don't accept samples, these could be a great alternative. And pretty helpful, especially for faraway patients. So the next one. So these are new savings options that have come about. The first one here is the Insulin Value Program. So this one's a new program that just came out this month through Sanofi, and it will actually cover 10 boxes of pens or 10 vials, which is an immense amount of insulin for only $99. And this will work for any uninsured or underinsured patients. It says not for Medicare patients. But they may be able to use it if they can get around it. But that's an immense amount of insulin for that cost. Also, Humalog has come out, or Lilly has come out with a generic Lispro that can be purchased for $99 a vial or $99 for a box of pens. This is a lot cheaper than the $500 retail price it is for Humalog, and it is the same exact molecule as Humalog, the insulin Lispro, and it's just a lot cheaper. Our last alternative for patients who can't afford a lot of insulin is the Novolin N and Novolin R. These can be purchased at Walmart, the Rely On brand, for $25 a vial. They don't actually even have to have a prescription for them. So if the patient's ever out and about and either loses their insurance or loses their insulin and they're in another state or something, they can actually go to Walmart and purchase these, no questions asked. So that's a good thing for our patients to know, just if in the event they were to ever have this. So our next screen is about patient assistance programs. So the first table up here talks about Medicare Part D. So Medicare changes every single year on what they cover. And the Part D prescription plans are confusing. So the patient typically has a $415 deductible, but they have to meet before insurance will pay for anything. And then the first about $3,000 and some odd dollars, the patient will pay only 25%. And then the patient hits what's called the donut hole. This is where they have to pay a larger amount of cost than they had previously. So that's where a lot of them really get in trouble when they say they can't afford their meds, they stop taking them and such. They have to pay themselves, I think, like $1,400 out of it here before Medicare will start picking up a larger percentage. So this is when the patient assistance programs come in. So I've pulled out Lilly Cares, and they would cover Novolog and Basaglar. And what I find is that it's a lot easier to do just one company, and just go to their fast-acting and long-acting insulin. So the patient just has to be a legal resident. We have to prescribe it, and they either have no insurance or their Medicare Part D doesn't cover the product, or they can't afford it. They have to apply for this low-income subsidy or extra help through the Social Security office to see if they either qualify for Medicaid or can get a lower cost for their medications and also their premiums for Medicare. So they have to have a denial for that before they can do this. So the program has also changed to less than 400% of the federal poverty level. So for someone who has, themselves and a spouse, it's actually $67,000 a year they can make and still qualify for this. So that's pretty high. Also, they have to spend $1,100 on prescription medications. So they just have to go to the pharmacy and show that they have paid that much out, and then they are eligible to be covered for this. This is just one of them, but the other ones are very similar. If the patient is financially unavailable to make or to purchase this medications, even if they can't make the $1,100, you can also kind of send in and explain to them, their financial situation. And even if you get denied the first time, if you send it in again, sometimes, they will make special considerations. So my last little tip for patients have called in saying that they've either lost their insulin, they went on vacation and didn't bring it home with them, they've left it out. The pharmacy can actually call the insurance and ask for a one-time override to cover the cost of this medication. But that is something that the pharmacist will have to do. But many times the insurance will cover the cost and not make them pay the whole price for it. And also another thing is cost savings. We do a lot of the work for the patient, but I think if they reach out to their insurance, they can, number one, find if a medication would be cheaper somewhere at a preferred pharmacy or something along those lines. And also they can check different pharmacies for price matching. They do have to call around and take the initiative themselves, but that can help. Walmart can be a lot cheaper than your mom and pop pharmacies, but that's their choices. So a few resources I found during this was on the AADE website. There's a spot called Access and Affordability, and it gave a few, I think 10 tips on how to save money on your insulin. It was a lot about, picking the right plans and health savings accounts and things like that. Not truly making the insulin cheaper, just kind of planning the next year to be a little more prepared. And then also I found this AACE prescription savings directory, and it went through any medication that would be used in an endocrine clinic that they have savings programs for. So you could go click out there and, it would take you to not only their savings program, but also like a patient assistance page. So it had a lot of information that I hadn't seen yet. So if someone comes to me and can't afford their meds, these are kind of the steps I go through to see if I can't help them, since we don't offer samples and things like that. So I have saved patients lots and lots of money. So I think that's all I've got. Does anyone have any questions?
Awesome. Thank you, Shri. Everybody over at MVA, do you guys have any questions about anything covered?
Yeah, thank you for the information. I'm sure you're going to send everything to us, the slide.
Yep.
Okay. And again, I'm not trying to promote any product or anything, but even for that company that gives Tresiba, Levemir, they have a patient assistance program where if a patient has spent $1,000 in the diabetic product for that year, the rest of the things like insulin, they can get it for free through the patient assistance program. And it has benefited some of our patients. The second thing is, we are a community health center, FQHC. So we have a special programming called 304B, okay, where we can give medicine at a discounted rate. But that is only for our patient, like the clinic provider has to write. Again, when I say that discounted rate, I'm not saying that it's gonna be very, very cheap, but it's still a discounted rate as compared to what they can pay at other pharmacy. And that is for all the medication, not just for insulin. Thank you.
Thanks.
Thank you.
Yeah, that's great. All right. Well, guys, do you guys have any diabetes educator-based questions? Because we have two wonderful ones with us right now, if you want to ask those. And that is about all we have prepared for today.
Short and sweet and to the point.
I'm happy with it. It's been busy.
Good to go. Thank you very much.
Guys, thank you again. Thank you so much. We'll all talk later.
Thank you.
Thank you.
Thank you. Bye.